Let's focus a bit on health matters now, and technology can help reduce critical medical and drug errors in both the private and the public healthcare sectors. And that's according to Dr. Yaseen Khan, the co-founder and CEO of digital healthcare platform eNCA. He says studies reveal that at least 8% of hospital patients show allergic reactions to treatment, and half of these can actually be prevented. Well, he's here in studio to speak to us a bit more about this. Good afternoon, Dr. Khan, and thank you for your time. So I think from looking at your article and the solutions that you are proposing, it all comes down to decision-making by doctors and healthcare practitioners at critical moments. Let's start there, because I think the statistics we are citing would not be a reality were it not for the importance of decision-making at that point. Am I correct there?
Absolutely. Absolutely.
Yeah.
So it is a critical point of potential failure in the system. And medicine errors, as you report those statistics, are quite substantial. And I think it's important, to note in the beginning, prior to looking at those statistics and how negative they may be, that we have healthcare professionals in the country that work incredibly hard under very, very trying circumstances. But the truth is, we do not get it right. It is very clear that medical errors, according to the WHO, can range from anywhere between 10% to sometimes 50% of cases. We have studies in South Africa. There's a study out of KwaZulu-Natal quite recently, which shows that in a pediatric ICU setting, for example, certain doctors, the study revealed that the doctors were unable to calculate dosing in about 75% of cases. And it's not surprising that when one looks globally as well, the US has very good statistics on this. It's claimed that about 250,000 people a year die as a result of iatrogenic or medication-related deaths. Now, we don't have very clear statistics in South Africa, but just based on those parameters, I think one can anticipate, one can infer what a substantial issue this is on the ground. Yeah. And so it's a very real issue, and that's really the area of focus, as you correctly pointed out.
So when we say medical errors, we mean what exactly? I hear you mention the dosage example. But what are the other examples that potentially then have an impact on the treatment outcomes of patients?
Yes, absolutely. So I think it's important to note that when we're talking about errors, and we're talking about medication errors specifically, we're talking about something that is deemed preventable and something that would ultimately have been in the control of the healthcare professional. And when we boil down to what it actually could be, there are a number of things that many of us as patients would be familiar with. It could be the incorrect drug. It could be that the dosage itself was incorrect. But it could be that, for example, two drugs on the prescription actually interact, and that has a negative effect. But besides those frank medical issues, it's really also an economic question. If a patient receives a prescription from a doctor, and that prescription isn't really the most cost-effective prescription, or the medications on that prescription realize an unnecessary co-payment from the medical scheme. How many times does this happen? Many patients have this experience. They're going to the pharmacy and they're presented with a co-pay. So one asks ourselves the question, if you come back to sort of an earlier point in the value chain, how precise and accurate is that decision by the healthcare professional?
Yeah.
And why is it not optimal? And so those are some of the errors that take shape. And yes, there are several more as well.
Yeah. So what are the factors at play that can lead to these errors? Because I don't think there's any doubt about the quality of the training of our medical professionals. Could it be issues of pressure and demand and the stresses and the working hours? Because, for instance, in the public sector, the hours that they speak of are just extraordinary, and the caseload as well.
Yes. So it's absolutely correct that certainly the intensity and the work hours is an issue. And the quality of our medical training is generally good. But if one takes a step back, it's a multifactorial issue, right? It's an issue, it's an issue of ongoing training. It's an issue of monitoring and reporting. It's also an issue of cultures of transparency and accountability around these things in medical circles. But I think very, very importantly, one important analogy is that if you look at the airline industry and how much the airline industry focuses both on training the pilots, but also ensuring that the system is sound and in full support of any potential error they can make. It is systems driven, it is software driven, and there's a checklist philosophy. Now, what's important and what we think where we think a substantial issue is there's been a lot of emphasis and burden on the capacity and competence of healthcare professionals. But the medical system, the digital system surrounding these healthcare professionals has not become as smart and as sophisticated as needed to prevent these errors.
In fact, let's make that your last point.
Yes.
How can technology, digital, artificial intelligence, and others come in and sort of remedy where the weaknesses are in the system?
So absolutely. So first thing to note is that there's a lot of digitization taking place in healthcare. But a lot of the focus has been on the transactional components, the billing, the records, and so forth. The role that we see that needs to take place, the action that needs to take place is that the clinical smarts need to be baked into the system. So the technologies and the data and the information that actually guide and protect the right dosage, the right cost of medicine selected. If an antibiotic is chosen, is it the right antibiotic for the area? Should it have been chosen, for example? And making sure that even though it's integrated in the systems, are the doctors actually using it? And working on that and making sure that we actually define what those issues are, gathering the data and making sure that we build the supportive tools. For example, the idea of intelligent digital prescribing and making sure that when doctors prescribe, that at that very moment of prescription, that they are effectively guided and supported to ensure that the prescription is accurate, that it's cost effective. And that's one of the things that we're very passionate and excited about. And we really think that something that as a crux point within the system, if we solve, we could really improve matters.
All right, I've got to thank you for coming through. I absolutely got everything that you are saying, Dr. Yaseen Khan, there from EM Guidance, raising an issue that I believe perhaps is just the start of a conversation that we possibly can take forward in the coming, months and years. All right, to